So I was very wrong. I thought I could teach a new upper level neuroscience course while keeping all of my laboratory projects running and still do YouTube videos. And it turned out that wasn't even remotely possible. I haven't had a minute in the past few months to do a video, but now the class is finished. It went very well. I'm very glad that I taught it. And now I am very glad to be back here doing videos. We are way behind on covering the scientific advances in chronic neuroinflammatory conditions. So let's just start now. I checked back and I promised in my last video that I would talk about the new FDA approved drug Tamaya. That's a drug that I have not worked directly with, but FDA approvals come so infrequently, it's important to talk about them when they happen. And Tamaya is sublingual cyclobenzaprine. It's officially indicated for fibromyalgia, and it seems especially well suited for the following person. You have chronic, widespread musculoskeletal pain. Because you have this pain, you have trouble getting to sleep or staying asleep. And because you have trouble sleeping, you're fatigued the next day. And that fatigue causes mental fog, which prevents you from doing what you need to do that day. And that inability to function causes stress. That stress amplifies your chronic pain, which makes it even harder for you to get to sleep. And round and round. So Tamaya is intended to mitigate this vicious cycle. And it does this primarily by targeting the sleep and secondarily the pain issues. So is this something that could help you? So first, if cyclobenzaprine sounds familiar, there's a good reason for that. And that's because this compound has been around for a long time. And many of you have probably taken it or you're taking it right now. It's frequently called a muscle relaxant. And at least in the United States, it's best known under the trade name Flexeril. Now, it acts on the brain. It crosses the blood-brain barrier very easily, and it acts on the brain to cause sedation, and it can also reduce pain signaling in the brain. So, why am I talking about a drug that has been around for a long time? That's because this is a new formulation where it's administered sublingually or under the tongue instead of orally. And in this case, that is not a trivial difference. It actually has a major impact on how the drug works in the body. And so it can change the way it works in pain and fatigue disorders. The reason why is because when you take regular classic oral cyclobenzaprine, the kind that you swallow, goes into your GI system, it goes through what we call first pass metabolism, and that's conducted by the gut wall and by the liver. And so when you take this drug, it goes into your liver before it even reaches the bloodstream. And this first pass metabolism converts the majority of the cyclobenzaprine that you just swallowed into norcyclobenzaprine. And norcyclobenzaprine is associated with long lasting grogginess, which is the chief complaint of using cyclobenzaprine. And the grogginess the next day can be so bad that even though the drug is working, it's not worth taking because it's just causing too much grogginess. Now, if you take the drug sublingually, which is this new Tamaya formulation, it enters the bloodstream directly. And since we're bypassing first pass metabolism, most of the drug is not being converted into norcyclobenzaprine immediately. And that means you can avoid this excessive daytime grogginess. So the sublingual approach allows most of the drug effects. You take it, you put it in your tongue right before you go to sleep. And the way it's formulated, it allows most of the drug effects to be gone around the time that you're waking up. And so it doesn't interfere with your next day activities. So that's the theoretical benefit. Question is, does it work? Well, the clinical trials look quite good to me. I'm not going to go through them in this video. I might do it in a future video if people are interested. The basic story is I see a really nice separation between Tamaya and placebo. I'm just showing you an example here. There's more than one trial that's been published. The drug shows significantly greater reduction of fibromyalgia severity, sleep problems, and fatigue. So I think it's pretty clear the medication has benefits. Now, one question that I'm interested in is, does this new Tamaya work significantly better than generic oral cyclobenzaprine? We don't know that for sure, although there's reasons to suspect Tamaya is superior. We don't know for sure because there's no direct head to head comparison between the two. It's what we call a superiority trial. These are very large, they're very expensive studies, and so I don't expect to see that anytime soon. But it's an important question because generic oral cyclobenzaprine is cheap. In my geographic area, it costs maybe $15 a month out of pocket. If I were to try to buy Tamaya out of pocket, it would probably cost around $2,000 a month, which is not affordable. Now, of course, you're unlikely to have to pay that. I have no idea how your insurance works. I don't even know how my insurance works. It's very possible that your insurance would cover most of that cost, maybe all of it. Again, I don't know how your insurance works. And if it covers the majority of the cost, it may be quite affordable to you. So it's worth checking into. Just be aware there's potential cost issues, specifically because this is a new product that's on patent. So it's always going to be much, much more expensive than generic formulations. Okay, now just a few things, not comprehensive list, but a few things to be aware of. First, if you had an allergic reaction or some kind of major immune reaction previously to oral cyclobenzaprine, it is a bad idea to try Tamaya because the substance is chemically the same. Um, Aside from that, the biggest complaint is going to be about local irritation of the mucosa of the mouth. And that's because the area under the tongue where you have to put this drug, it's very sensitive. And having a chemical sit there can cause irritation. And there's a variety of different ways that can happen. Some people can have an actual local immune reaction that can cause some irritation. In some people, the acidity level and the alkalinity level could be off a little bit. That can irritate the tissue. Also, the drug itself can act on the sensory nerves in the mouth, and it can cause some interesting sensations that could be uncomfortable. Now, there's ways to mitigate those issues, and if you take this medication, there'll be instructions on what you can eat, drink, how you brush your teeth, etc., to lessen those unwanted effects. The biggest issue that I can see, I don't know if I've seen this reported, but just kind of common sense, the biggest issue would be if someone falls asleep before the Tamaya dissolves, it could sit there under your tongue all night because you don't have saliva washing it and dissolving it. That is, if that happens, that's very likely to cause irritation. That actually happened to me a few months ago, not using Tamaya, but just using Ricola, the cough drops, because I was sick and I was coughing and I couldn't go to sleep. And so I took a Ricola. That's my go-to cough suppressant. And I put it in my mouth and I fell asleep with the Ricola kind of tucked into my cheek. And when I woke up the next morning, I had the Ricola still sitting there in my cheek. And my first thought was, oh, okay, nice, a Ricola in the morning. But then my immediate second observation was, oh, that really hurts. I burnt the side of my mouth with the Ricola. So, bottom line, if you didn't already know, don't fall asleep with medication in your mouth. All right. With that sage advice, that's probably enough info on safety stuff. You'll see some more if you ever take the medication. So I'll leave that to the physician to discuss with you. The only major tip I would give would be give it at least 2 months if you're trying it before you make a judgment on whether it's working. It can have effects in the first few days, but it really is designed to be something that takes a few weeks to unfold. So, if you suffer from pain and fatigue and cognitive issues with sleep problems associated with it, whether or not you have a diagnosis of fibromyalgia, this is worth discussing with your physician. It's another tool in the toolkit and something that absolutely will help some people. Even if you tried oral cyclobenzaprine previously, This is an entirely different mode of administration. It's a different dose. It's a different timing of administration. And so it's very possible that Tumaya can help even if oral cyclobenzaprine didn't. Now, I'll be very interested to see what the real world response looks like. It's a bit early. It's just now getting into the hands of patients. So I can't wait to hear the response when more people are trying it. It is available now, again, in the United States, but there's always a lag before physicians start prescribing it. They just have to learn about it and check it out. And then they'll start giving it to a few of their patients, engaging the response before they start giving it to all their patients. So I just wanted to let you know there's a new FDA approved medication. It takes so much money and effort to get a drug through the FDA approval process. It's always a big deal when approval finally comes. If we look at my FDA approval scorecard, and this is a scorecard for the conditions I spend most of my time researching, we see that fibromyalgia now has used to have 3, now it has 4 FDA approved medications. Myalgic encephalomyelitis chronic fatigue syndrome has 0, Gulf War illness has 0, and long COVID has 0. So I don't need to tell you what areas desperately need more attention. Now, fortunately, my lab and other labs are working on fixing that problem. I have a new NIH funded clinical trial I will talk about next time. And I just concluded a large clinical trial, and I'm analyzing those data right now. And I'm going to talk about those results soon as well. So there's good movement, which I like to see, but we still need to increase the number of clinical trials in this area. So I'll be back in 2 weeks with another video. I hope you're able to watch it. Thanks.